Acute lymphoblastic leukemia, brought to you by Medicine Isn't Scary. Don't forget to subscribe before you watch the video. Let's get started.
Hello guys, welcome back to my channel. So my name is Casa and welcome to Medicine Isn't Hard. So today I'll be talking about the topic of ALL, okay? So from the last video you could probably tell what is ALL just from the first three letters here. A stands for acute, L stands for lymphoblastic, L stands for leukemia. For leukemia, it actually happens in the bone marrow. And if it happens in the bone marrow, it means that it's affecting the blood factory. Okay, so it says acute lymphoblastic leukemia. So if the word acute, we can know that it is rapidly as a rapid prognosis. It could happen across week. It usually affects the child, and it's usually related to immature blah blah blah, okay, because at the time it's really short. Okay, so in this story, let's see what's happening in the body. Okay, so L lymphoblastic, it actually could lead to T lymphocytes and also B lymphocyte. Okay, so imagine your body is a blood factory. This time there is a rapid prognosis, a rapid problem related to the production of the lymphobatic cell, which is the T cell and B cell. The T cell and B cell were multiplying uncontrollably and they crowd out to the normal cell, leading to the bone marrow failure. These lymphoblasts are actually very young. And then, however, there is a problem for them. They failed to mature, which means that they were useless lymphoblasts. Okay, so you could imagine that you are now in a war, and then the factory is producing a bunch of kids out, which is not fit in condition to fight any infection war inside your body. Okay, and however, despite not having the ability to become a mature cell, these cells also have a problem. They failed to undergo the programmed cell death, which is the apoptosis. Okay, so which leads to the problem of your body building up with lymphoblasts, because normally the cell, imagine if you were a blood factory, you produce some nights out, you expect them to die at 60 years old. Okay, but now these kids can grow all the way to 100 years old. However, they remain as a kid and they were not fit for a fight, basically. Okay, so you can imagine that your body will be packed up with these lymphoblasts. And imagine if this lymphoblasts keep piling up inside your bone, it will lead to bone involvement, and then it will lead to bone and joint pain. Okay, so this will then become one of the major signs and symptoms that you would have if you have ALL. You have bone involvement, and you may have bone and joint pain. Okay, so for the patients with the problem of TALL, so they will usually complain to you with the mediastinal area painful. Okay, they will keep saying that, oh my god, my sternum is really painful, or when you press on it, they will feel that the pain was barely acceptable. So why is that the reason? It's because the blasts grow inside the bone, and then they lead to the bone pain. Okay, so this is the first sign and symptom that we will see. And then the second sign and symptom is because when you crowd out the normal cell, leading to the bone marrow failure, you can imagine that the red blood cell amount would decrease, because the factory is so focused on producing the other stuff that they were not able to produce the healthy red blood cell as the way that you used to. Okay, so the red blood cell will decrease, their red blood cell number and their neutrophil will decrease, and also their platelet number will decrease. So when you have less red blood cell, what would happen? You will suffer from a problem called anemia. So you will feel tired, dizzy easily. You feel fatigued easily. And then because you have a lower red blood cell and a lower neutrophil level, of course here we are talking about the effect negative ones, okay? It will make you more neutropenic. You will have neutropenia easily, and then because you have a low platelet level, it will lead to thrombocytopenia, which means that you will have easier bruising, petechiae, and also you will bleed more easily. So all of these combining leads to a symptom is what we call the cytopenia. Okay? So after understanding what are the two main signs and symptoms that you can see in ALL patient, let's see what are the things that could help us diagnose, okay? First of all, we will have the CBC, the complete blood count, which is very easy to understand, right? Because of the blast is crowding out the normal cell. You can imagine the red blood cell, white blood cell, and neutrophil keep decreasing. So you could, of course, view it from the CBC result, which is also very commonly the case how the patient find it out before. Yep. And then secondly, you need to do a bone marrow aspiration or the biopsy to see the amount of blast, okay? We would like to see, take some of the work result from your bone marrow to see if they were functioning. Okay, so the blast, we're standing about the non-functioning immature lymphoblast here. And then thirdly, we will try to have the flow cytometry, which is very important for the immunophenotyping, okay, which help us to know whether your problem is because of the T cell or if it's because of the B cell. Okay, it actually helps you with the target therapy. And then fourthly, it will relate it to the cytogenetics and also the molecular studies. The reason why here is because you need to know about the Philadelphia chromosome. So Philadelphia chromosome is especially is sometimes present in the ALL case. So by knowing that there is some problem with the Philadelphia chromosome, it helps you to do with the target therapy. Okay, last but not least, you need to have a number puncture so we will know whether there will be CNF involvement. Okay, ALL treatment, we usually tries to cure it with chemotherapy. We'll try to cure it with chemotherapy. Okay, and then second important thing about ALL is that you want to make sure that you want to prevent the TLS. So I don't know if you guys know what is TLS. TLS actually stands for tumoralizing syndrome. So it's usually led because of the large amount of cell death leading to some complication. So I'll have another video talking about what is TLS later, so we wouldn't dive too much in here. So you got to know the reason why you need to prevent TLS is because when we're treating a cancer with a chemo, of course, a lot of cancer cell will die, right? Then it will lead to a high chance of TLS, which is something that we don't want to happen within our patient. Okay, so you need to remember for the treatment plan for ALL, we usually try to cure it with chemo, and then because we're curing it with chemo, we want to make sure that we prevent the complication, which is we want to prevent the complication of the TLS. Got it? So this is a brief video of the ALL. So in our next video, we'll talk about the illness of CLL. Remember, medicine isn't scary. I'll see you in the next video. Bye-bye.
If you like this video, remember to give it a thumbs up and subscribe to my channel. I'll see you soon.